everyone, this is Gio from Rebalancing Health, and today I'm going to show you three quad stretch. So the simple reason why I'm going to show you these three quad stretch is because about 80% of the population, the general population, have overpronation injury. Overpronation injury are those injury like M.C.L. Or the medial collateral ligament, your medial meniscus, your overpronation at the foot, or wherever, a flat foot, a plantar fascitis. A lot of the time, people that have allus valgus, which is basically the thumbs um, um, going laterally or whether to the side or toward the other toes, or the bunion on the on the on the on the big toes. Those are that can be a consequence of overpronation, because by having the foot rolling in excessively, then you get in like a calluses. That's how it forms. It forms because there is a pressure, and there is a requirement. It creates friction, and consequently over time it will call in more fiber, tissue fiber, and consequently you get a bunion over time. Hip impingement, I mentioned the knee, hip impingement, flat foot, and bunion as well, and back pain also, because the that comes from over facilitation of this muscle like the quad, the psoas, and the adductor. But that over facilitation of those muscles tilt the pelvis forward. We have an internal rotation, however the femur moves in, rotate in like that, and that creates that knock and knee and overpronation pattern. But with that and the tilting of the pelvis create more extension or more curvature on the lumbar spine, so you get more compression of the disc. You get muscle that are stopped working, the lower abdominal stop working, the lower abdominal control the tilt of the pelvis, and consequently you have those issues that are coming along. With that said, with with that said, let's go ahead and I show you these three stretches. We're gonna start from the first one, which is a myofascial stretch. If you come into my class, um, at time I will perform some of these stretches. So split stance, uh, the front leg, the knee, um, you know, um, uh, above the ankle, and then what we're gonna do, you can use two hands to hold yourself up onto the front knee. Now when you are in this position that you lean forward, you reach back onto the back leg. So basically we have moved from the kneecap, we have went right on top of the femur now, on the femoral, um, uh, the joining between, just above the joining where the knees is formed, the knee joint is formed. So we right on the femur, and we're gonna grab the ankle, the back ankle, and what we're gonna do this time, instead of letting the pelvis tilting forward, we're gonna tilt it backwards. We're gonna flatten the lumbar spine, because if we let it tilt backwards, um, the actual muscle, or those quad muscle, those iliopsoas muscle, or those adductor muscle that are actually trying to tilt the pelvis forward. So with this position, we're reaching out with the opposite arm, left arm for me, push the femur down into the mat, and basically, because this is myofascial stretching, so it's a stretch of the fascia around the quad muscle. And imagine is that this sheet of connective tissue that goes above the muscle, that goes envelop the muscle, correct? So by having basically this area of my knee pressed down onto the mat, I pretty much what I'm creating now is like an anchor point for the skin. So so by then reaching forward, tilting my pelvis backwards, I give in the opportunity to that fascia or the muscle to slide and move and stretch inside of that fascia sleeve. Um, so perform it 10 seconds, 30 seconds is all depending, time of the day. If you perform it before for instance exercises, before exercising, 5 seconds, couple of times, 2 3 times on each side. Pay attention, perhaps you have one more tight on of the opposite or the other one, and consequently you may want to not stretch it equally. You want to stretch the one more tight a couple of more time, and the one less tight than the one less tight. The next one, if you have a Swiss ball, um, is pretty good as well. This one, if you have a Swiss ball, you can use a Swiss ball. You can use a chair as well, as long as you can bring your foot up into something. And again, as you can notice, my pelvis, if I moving backward, just backwards, my pelvis is moving forward. So what I want to do here is just tuck the pelvis under slightly, and I increase the stretch, and well, I'm stretching the quad now. You don't have to touch with the necessarily to touch with the heel to your butt, because by just tilting the pelvis backwards, the stretch will increase. And so that's for my right side. I'm gonna stretch on my left side, and my left side is generally um, a little bit less tight. So yeah, that's for the quad. And again, and for standing, you probably, most of you are familiar with the one with the ball or the one standing. And again, if you do a standing, make sure when you bring in that leg up, it's not about just bringing the leg as high as you can. It's by, no, I don't have anything to help me out with the balance, but is about actually taking that pelvis, tucking that pelvis under, and pulling on the ankle, and that create the stretch of your quad. So yeah, that's it. I mean, this is great stretches and great knowledge for you to have, because again, as I said, not necessarily the hamstring. Although the hamstring are one of the muscle of the lower limbs that is getting the higher percentage of injury, but a lot of the time is not about the actual fact that the hamstring itself is tight. Is actually because it's too long and too weak. It's being kept in that position by those flexor, however, your quads, again, the one that I already mentioned, that are pulling that pelvis forward and creating that tension and enlongment of the hamstring. So in saying that, if you want to strengthen those muscles to counterbalance the effect of those the quads, squats, back squats, on the wall with the Swiss ball. If you have knock knees, if you see that you're going into a squat and you're going into knock knees, just concentrate to put the weight on your heel, and now you will see if you have an overpronation problem, you will see you want to go onto the ball of the foot. And same when you're doing lunges. A lot of people that have an overpronation, which a lunge is already already better um, to correct that that overpronation. But if you will notice, if you're doing lunges and you're really quad dominant, you will want to do that instead of doing this, which now we get that hip extension, which is driven predominantly by your glutes. So doing squat, it will balance, the length and tension of your leg muscle at general. Um, Other, if you have a restriction and you are overpronating, perhaps you have some really tight gastroc, so look into that. But just perform the squat as with the best form that you can. Put a mirror in front of you, look at your knee, make sure that you're pushing the knee out, stretch those quads before, and yeah, good luck.